The stay home, stay healthy interventions are working and helping to slow the spread of COVID-19. Over the past couple of weeks, the governor has described his plan to slowly reopen the state. It is important to make sure that a loosening of the stay home, stay healthy order does not lead to more people becoming infected with COVID-19 or die from the disease. Although the state as a whole is seeing a decrease in the daily case count of COVID-19 or a flattening of the curve, Walla Walla County is not. We are seeing an increase in daily number of cases of COVID-19. So, as we slowly begin to reopen, there are several things we need to accomplish to make sure that we can do so safely. Many of these protections are the responsibility of our public health and healthcare systems, but several are the responsibility of our community. As we begin to reopen the community, we will monitor 6 key areas: disease activity within the community, increased access to testing, timely case and contact investigations, robust isolation and quarantine plans, our capacity to rapidly respond to outbreaks, and our community's dedication to protecting our most vulnerable populations. To safely reopen the community, we will monitor disease activity. We will consider the total number of cases of COVID-19, number of hospitalizations, number of deaths. We will also look at the rate of spread within the community. And we will look to see how our community is adhering to physical distancing requirements. Another area we will look at is our community's capacity for testing. Testing doesn't just depend on our capacity to test, but also the supply chain. And so we need to make sure that we have available test kits here within the community to be able to test anyone and everyone who is come into contact with a case of COVID-19. Increased capacity for testing will allow our community to quickly identify cases of COVID-19. Timely case investigations and contact notification is also critical to our reopening of the community. Our public health system is charged with investigating 100% of new cases within 24 hours, as with 100% of those close contacts within 48 hours. Our case investigation capacity is solely dependent on the staffing of our public health system. Not only do we need nurses, we also need disease investigators to assist with notifying close contacts. Once our cases and contacts are notified, we also have to manage those cases and monitor them daily. Isolation and quarantine plans are also a key area to reopen our community. Guidance for isolation and quarantine include staying home once you're tested until you receive your test results. If you test positive, you're required to stay home from your symptom onset for 7 days or until you're symptom-free for 72 hours. In addition, all close contacts of a COVID-19 case are required to quarantine at home for up to 14 days. Walla Walla County has robust isolation quarantine plans in place. Once tested for COVID-19, your healthcare provider will instruct you to isolate at home until your test results return. In addition, any close contacts of a COVID-19 case will be asked to quarantine at home. Guidelines on quarantine and isolation will be provided to you by your healthcare provider or by a public health disease investigator. Our public health system's capacity to rapidly respond to outbreaks is also critical in our community's capacity to reopen. Our response to an outbreak situation would include identifying all cases and close contacts, including any other individuals within the setting who may have been exposed to COVID-19. High-risk settings include long-term care facilities, assisted living centers, homeless shelters, meatpacking plants, and seasonal farm encampments. We also need our community to be dedicated to protecting our most vulnerable populations, individuals who are elderly or have compromised immune systems. Ultimately, we do this by limiting contact. However, we also need to make sure that we wash our hands, we don't touch our face, we wear a mask when appropriate, we practice physical distancing, but we also stay socially connected in creative ways. By being diligent in these 6 key areas, our community will be able to safely reopen.